morning. I'm Cynthia Bauer, the CEO of Valley Hospice, and this morning I want to talk to you about something new and exciting happening in healthcare in the Ohio Valley. Valley Hospice is privileged to bring you the very first community-based palliative care program in our area. Caring Connections Palliative Care has the potential to radically change quality of life for individuals with serious illness and for their caregivers, and to revolutionize how local, seriously ill individuals receive their care. Valley Hospice is uniquely positioned to provide expert care and guidance for those with serious illness because of our 35-year track record of making a difference in the Ohio Valley. Palliative care, or comfort care, aims to help patients feel better and cope with the stress of living with a serious illness. This medical specialty aims to manage pain and symptoms, decrease visits to the ER, and prevent hospitalizations and improve overall quality of life. For seriously ill individuals, worry and anxiety about the future can be overwhelming. Meeting patients wherever they call home has been a hallmark of our philosophy to minimize stress and anxiety whenever possible. Our Caring Connections Palliative Care team will provide in-home assessment, disease-specific education, comprehensive medication review, and coordinate with the patient's physician to help develop a plan of care centered around the individual's goals and needs. Goals may include emotional, spiritual, and social needs, as well as symptom control. This comprehensive approach to caring for patients as a whole person will allow for better quality of life for all individuals involved. Caring Connections Palliative Care may be a good option for patients with serious illness such as CHF, COPD, and advanced cancer who have had hospitalization within the past 12 months or are struggling with symptom control. I want to share a story with you. Some time back, Valley Hospice admitted to our hospice care a woman whose name was Connie. Connie was a 70-year-old woman who was living with CHF. When we encountered Connie, Connie's stated goal was, "I want to stay out of the hospital." When you look at the 6 months before Connie came to us, you understand why that was her goal. Prior to her admission to Valley Hospice, Connie had 17 ER visits in 6 months and 14 hospitalizations. After being admitted to Valley Hospice, Connie had no ER visits and 2 short stays in our specialized care center to get her symptoms under control. I want to talk a little bit about her quality of life, and these are things that Connie herself said. Connie said prior to coming to Valley Hospice, she experienced a loss of control. She could control nothing. She had fear and anxiety. She had lost time with her family and friends. She was focused on nothing but the illness. She had frequent medication changes and still no symptom control, and those caused her confusion and a financial burden. Connie said one of the worst things was her inability to participate in family events and her hobbies. After admission to Valley Hospice, during the 8 months we served her, Connie said that she had an increased sense of control over her illness and her life circumstances. She had less fear and anxiety. She had the ability to spend more time with her family and friends, do things she wanted to do. She was able to attend a college award ceremony for her granddaughter, a surprise birthday party her family threw for her and enjoy it, a Mother's Day celebration, and a trip to Kansas to visit with her brother and his family. Connie was not an unusual experience with us for hospice, but up to this time it was restricted to hospice. With Caring Connections Palliative Care, Valley Hospice and Caring Connections will be able to allow individuals to experience improved quality of life much earlier in their illness. Philanthropic and community support are essential to the creation of a strong, successful palliative care program in our Valley. Valley Hospice is very grateful to have received 2 grants supporting Caring Connections Palliative Care. One from the Mary Jane Brooks Charitable Trust, and one from a local anonymous family foundation. We're extremely grateful for their support. Caring Connections Palliative Care has the potential to touch most people living in our valley in one way or another. We are pleased to provide this service to ensure that individuals in our community will have resources they need at the time they need it most. Thank you very much.